your talk. Sir, we ask you to continue holding. We're going to now go to the KUAM News Zoom room where we have, not even an hour into the show, people calling for his resignation. He's the chair of the Physicians Advisory Group, Dr. Hoa Nguyen. Bree, could we kind of like unpack a little bit about what had happened when the governor came out, announced her executive order, and then it turns out that it wasn't what the Physicians Advisory Group advised her?
Right. So the governor said, somebody had asked about more time. Then Maureen Martita had actually also asked about, why don't you give these businesses more time? Because, you issue this order, the protocols aren't even out yet, and they're going to have 48 hours or so to implement
36 minutes and counting.
Right. And so she said, I don't want to get into a he say, she say thing. But then Mary Rhodes issued a statement minutes after.
And what did she say?
She said basically that they did meet with public health on Thursday. They did discuss restrictions, but there was no real discussion on a mandatory vaccination policy. It wasn't what the PAG had recommended. The PAG had recommended this 100%. You can operate at 100%. As long as you implement, this where if you are vaccinated, you can dine in. If you're unvaccinated, you can dine out. Or you can operate at 50% capacity where, it's unvaccinated or vaccinated. And, of course, the mask mandate. So, and then Dr. Hoa, confirmed, that's basically what they had recommended.
So it wasn't a case of us playing he said, she said. It's just that.
What was said.
That was what was said, actually.
But, Chima's here. We can make sure.
Right. So let's bring on Dr. Hoa Nguyen now. Good morning, Doc.
Hey, good morning, guys.
Okay, so I saw the front page of one of the papers this morning. You're calling for this order to be rescinded. Let's just start there. You want this order pulled?
Now, the order need to be make some major change. I think that we can either remove it or make some change to kind of number one is get the mandate to be removed. I don't think that we can mandate the employee of a private company. So I think that's something that I really want to push. We can highly encourage every company in Guam to have the people vaccinated. As you know, my stand is that the immunization are very safe and protecting you, and really protect you, the family, the community. But at a certain time, you cannot kind of mandate everyone at the private company to be vaccinated. Now, to make sure people understand, AMC and GRMC, we mandate our employee to be vaccinated. But that is our decision because of we are in the healthcare business, and that's to protect our employee, our patient, our family. So that's the choice that the company make, not because the government asks us to mandate our employee to be vaccinated. So I think that decision of mandate the employee of the business to be vaccinated, that should really need to be changed. I think that we have to respect people's choice of getting the vaccine or not getting the vaccine, and that's why when we work out the detail with the business side of the house, we really give them option. Business have an option to either check the status or not check the status, but we build in restriction for that just for safety to public. I think that's a compromise that it will work best for the business to keep them open rather than you can see now some of the business that decide to close their door because of the mandate. And that's not what we want to do to our business in Guam, especially the small business.
Right, and I thought, that whole thing where you were mentioning about having the legal authority, I know that was a question that was brought up during the press conference on whether the governor did have the legal authority to do this, and I believe she said, well, she has the Organic Act authority that provides her that authority to issue this sort of a mandate. But what I also found interesting is that when she issued her Instagram video at 9 o'clock at night,
Yeah,
I
on
think it was
Saturday, couple
like a
Saturdays
week
ago. Yeah.
when she was talking about the mandatory vaccination executive order for GovGuam employees, she said, I highly basically recommend that the judicial branch, the legislative branch, and the private sector follow her lead.
Mm-hmm.
So in saying that, it just kind of makes me wonder, do you have the authority, the legal authority to do that?
Or was it just that she said, I hope they follow my lead, and it didn't look like they were, so she was like, no, I'm going to force you to follow my lead.
So I'm not sure the legality of it, but I'm very sure that I think that the private company is really they should have the last voice on mandate the employee or not. You know, there's certain sector in our business, just like the nursing home. It will be mandated because most of the nursing home in the state are granted by the federal funds. So yes, if you are in that category, then yes, you would mandate. But now, like say restaurant, the mall, the movie theater, I think that they should not be mandated at all. And you know, I mean, for us to curb this restriction, I mean, this surge right here, we really you know, need to identify where the cluster coming from, right? And we know the cluster coming from the bar, that's number one, from the large gathering, that's number two. So I think we should concentrate on those, and the way we do that is just limit the gathering. I would put all the way down to 25, and that's what we suggest, you know, because, you know, 100 is still a lot, plus, you know, 100 vaccinated people can carry the virus, you know, asymptomatically, and they can carry, you know, give shudder without knowing it. Now, they're not going to be that sick, but again, it's a risk for these people to pass it on to unvaccinated people in the community. So I think the larger the number, the worse situation we're going to be in. So that's something that I think it should be way down. So again, the EO have good intention. It's just that is I think that it should be changed a whole lot, and so that way we can protect the people right on this deal.
Dr. Nguyen, can you just clarify, was the recommendations that the PAG had, was it a Dr. Nguyen recommendation or was it a PAG recommendation in terms of all the members of the Physicians Advisory Group? Was it something that the surgeon cell agreed with?
We talk in the PAG, and you know, it don't have to be unanimous, it should be majority, and we passed on the majority of recommendations for the business, and we just talk about, you know, the restaurant, because we didn't think that the other service related business are at any risk at this point. So, you know, as again, the people need options, so we come up 100%. If you check the vaccination status and you unvaccinated, but you have a choice to eat outside, because people need to go out and dine outside if they want to, or if you want to not check on vaccination status, then we can go to 50%. That's what we do all the time now, the past several months, and it's proved to be very safe when we are 50%. So that's something that certain business and restaurant can afford to do. So that's the business side that we, just like Mary Rowe was saying, that's what we agree and recommended on. You know, so again, our goal is to make sure that the surge has been under control, but also we need to look at the business side and make sure the business are safe to go forward, and not shut them down.
So when did you find out that this was she wasn't going with your recommendations? I mean, did you find out at the 3 o'clock press conference, or did you know?
At the press conference, you know, at the press conference, and we didn't know the restrictions that strict. Again, you know, the PAC will make the recommendation, but the government have the final saying. But I have to clarify that that's not the PAC recommendation. So to make sure that people understand that we recommend it, we're working with the business people, but that's not our recommendation on the PAC side.
When are you meeting with the governor? When's the PAC meeting with her? You still have your Monday meetings? Or?
We try to have a meeting with governor later on tonight, just to clarify some stuff, and we hope to work out some issues, make some change. I think again the intention, everyone have the same goal. The goal is to make sure that this surge here is under control. But there's a certain way that I personally feel like we need to approach things differently and not violate people right on this one. It's really it's a freedom of choosing. We can highly again recommend it and highly recommend it, but you cannot mandate individual in a private company to be vaccinated in order to be open.
Doc, I did want to ask you, because I have been getting questions about pregnant women. Are they should they be getting this vaccination? If say I'm working at one of these restaurants and I'm pregnant,
knocked up,
would I have to get this vaccination, or is it safe for me to get this vaccination?
I think the new ACOG say that pregnant patients are recommended to get the vaccination. It's recommended by the OB organization, but again, the certain OB will have a different opinion. But again, I think the general guideline is they recommend it. Dr. Shea probably give a better answer on that one, but that's why I'm reading that the ACOG is recommend now for the pregnant patient to be vaccinated.
Right. But I mean, it's unfortunate because if that pregnant woman and her family decide, and it's well within their right. I actually know the couples who are expecting a baby and did not get the vaccine because the woman was pregnant. But she's going to lose her job, right? This pregnant woman is going to lose her job if she doesn't get vaccinated. That's crazy.
No, that's the right, and I believe that even for our clinic, if pregnant, my pregnant employee, if they don't want, I cannot force them. As mandate we have to make certain exceptions.
Doc, we're going to bring Chima on here real quick. He's asking to come on with you. Chima Mbakwem, who's the Chief Public Health Officer. Chima, good morning. We also got Tom Nadeau here. I don't know how long Doc has got, but we did want to bring you guys all on together here.
Thanks for joining us, Chima and Tom. I did just want to touch on something that Dr. Hoa had mentioned about the restrictions and the recommendations, and they didn't come from the PAG. Did they come from public health?
Good morning. I think what we need to make clear here is that advising or making recommendations to the governor is a privilege. So I think we have to clear that first, because when we have that executive privilege, we really need to look at what recommendations we make and how that recommendation also marries to other recommendations. Because the PAG is making recommendations, public health is making recommendations, and I think it's up to the governor as the final authority, to be the one to make the final decision. And for us at public health, that we are actually the entity that implements and operationalizes all these directives from the governor. So I think if we're clear on that, then that would actually drive where this conversation is going to be going to. So first of all is recommendations, right? We look at it from the point of prevention. We look at it from the point of protecting the community. We're not looking at it only from the business community. We're looking at it from the schools. We're looking at it from the church. We're looking at it from every possible way to mitigate transmission in the community. So public health recommendation is strictly on how to prevent transmission in the community and keep the community safe. So that being said, public health had recommendations. But our recommendations would also be part of other recommendations from other groups. But when the governor makes a decision, it is up to us to operationalize it, because the signature of the governor and the signature of the director of public health is the authorizing signature to carry out those mandates, right? So that being said, what is being recommended today is what we believe is the best approach for the community today. It could change tomorrow morning. It could change in 2 hours. But with the data we have, with the level of transmission we have in the community right now, that recommendation is the best that we can have now. If it's looking at the implementation of the EO, then it lies on public health to actually create the guidance on how the community should go. So I think if there are challenges with the implementation of the guidance, it is up to us to sit back and look at it, putting into consideration those challenges. But discussing recommendations and authority are two different things. So I just want us to be clear as we move. So recommendations are things you say to somebody, then the individual decides to take what you say and then makes a decision, but the decision lies on the individual whose signature is on that. Thank you.
Okay, so I'm sorry, did you say yes, public health came up with the recommendation for the mandatory vaccinations to be imposed on private sector?
Like I explained to you,
Oh, you didn't.
there are recommendations that were made by certain groups, right? And those recommendations were looked at, and the best decision was made based on those recommendations. So our role we made recommendations, like the park said, they made recommendations. But at the end of the day, those recommendations were actually addressed and a decision was made, and that decision is binding on all of us, and then we're going to carry out that decision. But if for any reason there are challenges in implementing that decision, or there is a need, to address some of the challenges in that, then it becomes imperative that we do that. But the fact is that we are part of that recommendation. We are implementing the recommendation. We wrote the guidance for that recommendation.
So yes, because the PAC just said they had no clue. JHRA said we didn't know about that.
Yeah.
So,
I get what you're saying, Shima, about what did you say? It's a privilege to advise the governor. But all I'm saying is, Shima, throughout this pandemic, the Physicians Advisory Group, like we in the media, have relied on them because they're advising the governor, and the governor, for the most part, has followed their recommendations throughout this pandemic. So you can't fault us for entertaining Dr. Nguyen when, I mean, he's talking about, yes, they did make recommendations to the governor, but it's been very routine for the governor to follow a lot of these recommendations. So I just don't think now is the time for us to be like, oh, well, what's the PAC even talking about? It's a privilege to advise her. They've been advising her for the whole pandemic.
I'm not saying the PAC is wrong. What I'm saying is that
No, I know.
We also made recommendations. Public health made recommendations, right? The PAC made recommendations. What I'm saying is that all the recommendations that were made, were weighed and a decision was taken, right? Yeah. So I'm not coming out to say public health. I'm not discussing public health recommendation. What I'm discussing is the final product of PAC's recommendation and public health recommendation. So that is the final product that I'm discussing. So the PAC has been very instrumental in bringing us to where we are. We have been also part of the PAC's meetings. We have been part of, the PAC has actually discussed with public health on issues that they feel we should know. So it's a relationship that is ongoing. But what I'm saying is that the PAC's recommendation was actually tabled. The same way public health recommendations were actually tabled, but a decision was taken. So that's what I'm trying to explain. I'm not saying that their decision or their recommendation was wrong. No, they made a recommendation. We accept that. Mm-hmm. We also made a recommendation, but it is binding on all of us, as a team, that when a decision is made, we carry out the decision. But if there are instances we do not agree with the recommendation, we can internally sit down and look at the challenges and address those challenges. But at the end of the day, the whole intention is to keep the community safe. And that's what I'm saying.
But Chima, if public health had their recommendations, why didn't they bring that to the PAG so that they knew instead of finding out at 3:00 during a press conference? And on top of that, if you met with GHRA on a Thursday before the governor made the announcement on a Friday, why didn't the public health bring that up to GHRA and say, hey, we're coming out with this mandatory vaccination, all you restaurants, you clubs, you fitness centers, this is what's going to happen? Or this is on the radar.
Okay, so Sabrina, like I said, recommendations. Oh, just look at the word recommendation.
I know what recommendations means.
Okay, all right, hold on, everybody. I'm vaccinated. Stop talking because I'm vaccinated.
All I'm saying
Dr.
is,
Hoa,
if you had recommendations, why didn't you bring it to GHRA on that meeting on Thursday? Because the governor in the press conference was basically saying, Mary knew what was going to happen.
Yeah.
I don't know why.
I got ran over on that question. But Doc, because I know you don't have all morning, did you want to respond to any of this before we let you go?
Yeah, all of this is again, we, like Chima say, we strongly make a recommendation. Again, I still have not sure who's advised the governor and the much stricter guidance. I don't know. I wish I can find out so we can talk to that person or the group, just because I think that the governor can only make decision based on the information that you give to her. She make the executive decision if she have the right information. That's the thing is that I think that, again, the idea of the EO is the intention is to curb the surge, but we really need to go back and revise the majority to EO in order for us to make sure that it's safe for Guam and it's also safe for business to stay open. Again, and it's also to protect the freedom and the free choice that people that can make. And that's why I say that it's boiled down to everyone. Each one of us have a responsibility to protect ourselves and the people around us, but we cannot mandate certain things on the private side, on the public, and that's why we have to go back and make some change. But again, I want to clear because whenever the EO come out, the physician advisory group always have attached our name on it, and I think the physician and the pharmacist and people that sit on this board is excellent, and they really dedicate their time, their free time, to do that just because to move Guam forward in the pandemic. So I'd like to say thank you for the member of the PAC. And
thank you, Doc.
We will try to make sure that and again, I keep saying every meeting, PAC and public health are on the same team. We're not fighting. We have to work together in order to move this pandemic forward and make sure Guam stay open.
Well, it sounds like y'all also need to share information.
That's all I can say. So yes, communication will be the main thing. We need to really open that communication up internally to make sure that the certain cell, the PAC, and public health the same thing. I don't think that no one should be the lead. Everyone should be equal in order for us to move forward. And that's the only way that you can encourage open communication, because everyone's opinion should be weighed the same. And no one should be the lead on this one. Public health will draft the final EO, but whatever decision is, but it should be reviewed by the certain cells, should be reviewed by the PAC, before we give it to the governor, because again, she's the one ultimately responsible for it. I think that that move forward, we have to have everyone on the same page.
All right. Thanks,
Thanks, Doc.
Doc. If your
Okay.
privileges get revoked, you're always welcome here. So thank you.
No, it's okay. I'm a strictly a volunteer, so again, I do this for the love of people of Guam, and this is not for anything that we do. We have to fight, because if not, I tell you, this number right now, 25 in the hospital, it's not the end. It will continue to go up if we don't fight this in the way that we have the cooperativeness of the people of Guam. The people of Guam are very good. I tell you, you see that they come out in a great number for immunization. So our people are totally different than anywhere you can find. And my hat is off to the people of Guam and come out and get the immunization. Despite the EO, they still very much work with themselves in the community. So thank you so much for our people.
Right. Thanks, Doc.
Okay.
For
Thank you,
coming
guys.
on.
Yeah,
And I
appreciate
think
it.
we don't want to lose sight of the fact that, yes, there are over 25 people that are hospitalized in our hospitals